Uh, Hi guys, and welcome again to my channel. This is my new show. It's called Crazy by Austin Munara. Uh, we'll be discussing a lot of things like mental illnesses, uh, a lot of stuff really. Yeah, in this show, so this is episode 1, and in episode 1 we choose to look at schizophrenia. So schizophrenia is the number one mental illness out right now. Uh, so most ill patients are usually diagnosed with schizophrenia. If you go to the psych right now, you'd find most of the patients have been diagnosed with schizophrenia. It's the scariest and the wildest one. Most mental illnesses are usually mild. It'll make you misbehave and behave a bit odd, but schizophrenia would definitely get you off the rails. Like you would definitely uh, be behaving odd, seeing things, feeling things. Yeah. So in this limited edition series, uh, we'll be looking at a lot of things so crazy, schizophrenia. Uh, uh, a while ago, I myself was taken to psychiatrist facilities. These mental illness facilities. I don't know what they're called. I was taken there. When I was a kid, I had my own issues. Uh, so I was tested, diagnosed after a consultant. We consulted with a specialist. So he said I myself had schizophrenia. Said so. I was given a lot of drugs. The drugs usually given to treat schizophrenia are usually called, what are they called? Something, this yellow small pills called. Uh, Something, I forget the name, but usually given some pills, some medication. They're really strict. If you catch schizophrenia, you might be expected to take those medications once a day, once every night, for the rest of your life. Actually, it's a treatment, really, not a cure. So if you get diagnosed with schizophrenia, you'll be taking medication for the rest of your life. Every day you're supposed to be taking medication. Well, I don't know if it's for the rest of your life really, but in some instances I think the doctor can say that you're cured and get you off the medication. Though what I hear about the situation is that if you really get off the medication, then you had put yourself at risk for the schizophrenia to come back. Now, crazy, there's a lot that goes into it. Like, what do you say? In the world of mumble rap, crazy is like a great perspective on mumble. So I decided not to make this as a record and then mumble it. Maybe I should make it into a show and discuss it. So crazy is definitely mumble rap. As you can see, we are going to look at it and break it down, or part by part, check into, even open the medication cabinet if you would, right? So crazy, what I would like to say about crazy is that it's like going bonkers, going mental. It's dope. you'd catch a gold chain. Schizophrenia, it's crazy. Mambo rapping, right? It's fresh, it's new style. Like you'd be rocking it, right? You're rocking crazy head to toe with a blend of something else, crazy, so fresh, unique. As you can see, I'm dipping into crazy myself, right? And I'm trying to rock it like in my designer speed, in my etiquette and my style, even in my unique way. I'm rocking it myself. So, yeah, yeah, crazy can be considered mumble rap. Yeah, crazy should be considered mumble rap. But, but that's just a brief introduction and a synopsis about what we are going to try and do here. So, so this episode one was mostly supposed to focus on schizophrenia. Some people call it schizo. Uh, Schizophrenia is actually pretty interesting. It's been around since the 1800s. Mad doctors used to try and treat patients with crazy and, electric shocks, trying to cure craziness. Uh, but, but these days there's definitely a treatment. You go to the hospital, they'd give you an injection. So you'd be in safe hands. Modern medicine has come around and it's actually treating it very responsibly. Personally, as patient zero, you'd see I'm definitely cured. Though I still take my medication. But yeah, you can say I'm definitely cured. So what else about schizo? Um, so the symptoms of schizophrenia are you feel things, you see things which are not there. Uh, Patients have been known to hear voices, experience people talking to them, people who are not there. What else? You might feel uh, an upset in brain activity, like in the brain you'd feel some activity like stuff like pulse, heaviness, and unsettledness, like something's bothering you, like a stomach ache, but not the normal headache, but just being unsettled. Um, what else? I'd say this is definitely fresh, right? Like episode one, schizophrenia. How is it not fresh, right? It's definitely classic, right? So, uh, yeah. Mm, well, these days schizophrenia is not terminal. Uh, I don't know what you'd say about the people locked up for it right now, because uh, surely they should be cured, right? If the medication is actually, yeah, but those guys usually have been known to interact with crazy things, like be going back to the root of the problem, mixing up things, being stubborn, having a severe case that makes you not even behave normally. Some people are just down. Some people are just mental. That's usually the problem. So, what else? Schizophrenia as a fashion spray is definitely fresh, classy. I don't know if you'd say it's up right now, but it's what I'm working on. So I wouldn't say it's for the public, really. Really? Nah. It's what I'm doing, and That's why it's fresh. Cause I'm fire. If you follow me, you know my style is electric. You know I'm really cool. I'm really dope. You can see episode 1 is schizo, non-stop crazy. Yeah. So that's about it for today. That was episode 1, schizophrenia. Or I talk about the dead people who died in the 1900s, 1800s, and 1700s because of mental illness. I, we talk about the murderers and psychopaths who have been known like to kill, like for example Jack the Ripper and his king. Those guys maybe should be diagnosed with schizophrenia. If you get a specialist, they'll tell you that these people have been exposed to experience extreme levels of schizophrenia, which has driven them to actually take lives and behave in a psychopathic way. What else? I don't know if craziness is still on the table. It's rare that you find a crazy person in the 21st century because of the medication. Yeah, that's about it. Until I see you again.